What is normal postpartum bleeding, and when to worry? Imagine holding your newborn and suddenly noticing a flow of blood that feels different from a regular period. That's often postpartum bleeding, a normal part of recovery after giving birth. It's called Lochia and is your body's way of shedding the blood, mucus, and tissue that supported your pregnancy. As your uterus heals and shrinks back to its pre-pregnancy size, this bleeding begins. It usually lasts about 4 to 6 weeks but can sometimes go up to 8 weeks. In the first few days after delivery, you'll notice heavy bleeding, similar to a very heavy period, with bright red blood and small clots. This is called Lochia rubra and is the heaviest phase. You might soak a thick pad every few hours and experience mild cramping because your uterus is contracting. Around days 4 to 10, the bleeding lessens and changes to a pink or brown color. This is Lochia serosa, and the discharge contains more fluid and less blood. By days 10 to 4 or 6 weeks, the discharge turns yellowish or white, mostly mucus and white blood cells with very little bleeding. This is Lochia alba. It's normal for bleeding to be heavier during the first days and then gradually decrease. Sometimes, you might notice a sudden gush of blood when you stand up because blood can collect when sitting or lying down. Light spotting can continue for several weeks, and you might see small increases after physical activity. But it's important to know when to seek help. If you soak a pad every hour or pass large clots bigger than a golf ball, that could mean excessive bleeding or postpartum hemorrhage. If the bleeding doesn't slow down after a few days or suddenly gets heavier after being lighter, it's time to check with your doctor. Symptoms like dizziness, weakness, rapid heartbeat, or foul-smelling discharge are signs you need medical attention. Also, if you develop a fever or severe abdominal pain, don't hesitate to reach out. Monitoring your bleeding pattern and symptoms is key. Use hospital-grade pads or thick pads initially and switch to regular pads as bleeding lessens. Avoid tampons to reduce infection risk. Keep track of how much and how often you bleed, and share this information with your healthcare provider, especially if anything feels unusual. Understanding what normal postpartum bleeding looks like can help ease worries during recovery. Remember, some bleeding and cramping are expected, but heavy or prolonged bleeding is not. If you notice anything concerning, seek medical help promptly to keep yourself and your baby safe and healthy.